Afternoon, ladies and gentlemen. Good afternoon to all of you. Welcome to this week's Civic Space Community Show that is hosted by Civic Space TV and Center for Constitutional Governance. Today, we are going to discuss something that is a bit urgent and has befallen Uganda yet again, and that is the Ebola outbreak. On the 20th of September, the Ministry of Health of Uganda announced that Uganda had registered its first case of Ebola, and there was an Ebola alert issued. More technical words will be given to us by Doctor. So to help us in discussing this, we are going to have a presentation from Dr. Mark, who is, Dr. Samuel, Dr. Samuel Oledo Odongo, who is the president of the medical practitioners in Uganda. Thereafter, we shall go into a discussion with the other panelists around. So, Doctor, for purposes of time, I want you to briefly introduce to us the status on ground in regard to Ebola outbreak and what is Ebola anyway. You will also tell us some of the signs of Ebola, and you'll give us what measures are in place by the government to address this this catastrophe. Yes, and the other doctors on the call will delve later into the tips on prevention and first response. But you can also tell us the condition of the people who have been registered having the virus, and very importantly, the medical workers, how are they responding, and what is their condition like, considering we've also had some on strike in some hospitals, and key in Mubende Hospital, that is the epicenter of this. Over to you, Doctor.
Thank you so much, moderator. I'm Dr. Oledo Samuel, President, Uganda Medical Association, and a special welcome to those other colleagues who have commended the health workers who are doing a great job, so that the outbreak of Ebola that we have in Uganda meets the appropriate response and is mitigated as fast as possible. Ebola is an hemorrhagic disease, and also attack on the different body organs that are basically responsible for survival of an individual. It attacks the vasculature, the vascular system of the body, the blood vessels majorly, and then all the systems of the body. That's why you see its manifestation coming in the GIT, patients ending up with diarrhea, others ending up with dysentery or bloody stool because of constant erosion of the walls of the GIT system as it progresses. It also affects the other systems of the body, respiratory system. Right now, allow me to applaud Ministry of Health and then the Ugandan government, led by the president, for the absolute measures put in to see that the hemorrhagic viral disease that we are having, Ebola, which is among other hemorrhagic viral diseases like Marburg. Currently, we do not have the vaccine for it, and we are the other systemic breakdown drugs that can be used to mitigate them. For example, if it is a GIT system, we treat it asymptomatic, the different presenting symptoms, and then drugs specifically intending to stop any, the 6 of them. We have, as per this morning, we have one intern and then one SHO who are really doing badly off. They're right now on oxygen, and as Uganda Medical Association, we are trying to mobilize, have these our dear colleagues have either HDU attendance or ICU attendance as fast as possible. But with the look of things, we are tending to the ICU attendance. It is very unfortunate that this morning, other medical interns started showing clinical symptoms of Ebola virus among the remaining medical interns who are in Mubende Regional Referral Hospital. And this is not so good news. We are saying, as the president spoke yesterday, emphasized on the issue of the vaccine. Yes, there's a possibility and there's a window of us in Uganda, the scientists in Uganda, coming up with a vaccine. Because now we are faced, is the Ebola Zaire vaccine was discovered, but of course from the convalescent plasma of the other patients who had suffered it. So it is our prayer that the scientists are facilitated, and then the health team is fully involved, well facilitated and well protected with available PPEs, the precising the issue of protection, that every health worker must have protection. But in the risky zones, we must have fully breast up protection, because the cases that caused this spread to other health workers mimicked other medical conditions. Because the health workers, the SHOs we are talking about, the senior house officers we are talking about, who are 3 right now in isolation, who are under treatment, were actually from surgery, and only one, the 4th surgical case, which mimicked a surgical condition, and yet was a complication of the disease itself onto that individual. So when they opened up the patient, they were all exposed. And right now, all of them, they are sick, but 1 out of the 3 is doing bad, is on oxygen. And then the intern also, who was in the same team, also is doing so badly off, is on oxygen now. Let's pray for health workers who are doing so bad, as we also we do the medical intervention which is necessary, ICU management. But I'm asking the country, please, let's pray for the health workers. We lost 64 in COVID-19. We do not want to lose any. We do not want to lose anybody at such a time. It breaks our hearts, because these are our colleagues, these are people we've worked with, these are guys we've moved with, we've traversed with. It is not nice when we lose them at such suddenly. It is sickening. So I'm begging the nation, let's pray for our colleagues. I'm begging Ministry of Health, the government of Uganda, let's mobilize. If the worst comes to please, let's do that. These are young doctors. They are the future of the medical profession. It is not nice to lose a doctor who is 26 years old. It's painful. He might be in the age of 50, but he's a senior. So it is our cry to the study. But it's a high time as health workers. We are saying, we are begging as a father of a nation to come on board, please. Put mitigation measures. It is key. I'm begging the Parliament of the Republic of Uganda, please, let's allocate resources. Let us release a supplementary budget for this specifically. I'm requesting Mama, Honorable Anita Mong, the Deputy Speaker also, Honorable Tayewa, the Right Honorable Deputy Speaker, please, let Ebola be top onto the order sheet. Let it be key things that we discuss. I know today there's elections and all that stuff, but elections can wait. This is life we are talking about. The same health workers who are at risk right now, who may die, are the only few who are handling cases in Uganda. We have a staff gap of 60%. One doctor sees 25,000 patients. That is not so nice. So we cannot afford to lose any at such a time. And now that our dear 2 colleagues are critically ill, others who are interacting with them in Mubende are also starting to experience clinical symptoms, which are not so nice. I request all samples from all the interns and all the doctors who worked with these colleagues and also who are in that same environment be taken. Let us monitor them. Let us intervene as early as possible before the manifestation, the fully blown manifestation of the disease, so that we can have mitigation measures as early as possible, enrolling them on antiretroviral therapy as early as possible, the positive identified early cases, rather than waiting for them to be compromised and the body system has been weakened, the immune system has been broken down, both the innate and the moral broken down, and then we start coming up to, we are requesting you, please, the government and even any other organization, that is positive, that is willing to stay, please come and mobilize resources. Ebola, its ability to infect might be a little bit lower than COVID-19 because of the mode of transmission. But when it attacks, when you get it, the chances of survival are very slim. The chances of survival are very slim compared to COVID-19, which the transmission is soft, but it can easily be suppressed when it is in the body system. Unlike Ebola, and painfully, this Ebola Sudan is not a very nice one. So we are praying that all those things that we've put up across let's also have, we have over 2,000 doctors unemployed onto those who are working. You're finding the health workers who are there are working constant shifts. We need to have reduced contact with the patients, right from the other wards and also the infected wards in the whole of the Mubende belt and all of the hotspots. You cannot have a doctor move through the wards and see patients over 48 hours in 3 days in 7 It is not appropriate. Too many redundant unemployed doctors in the different countries, in Sierra Leone, in Congo, and other nations. Please, this is a time for you to come up. Let's mobilize each other. Let's work with Ministry of Health. Let you be deployed with appropriate PPEs, appropriate facilitation. Let's serve our nation. Right now, Uganda is the third on the high mortality rates of Ebola, following Sierra Leone and Congo. We do not want to bypass and become the first. No, we don't. With reluctancy, there are great chances we might beat a record. And there's no good record when people are dying. It is not nice. So it is high time we come up and then we mitigate the issues. Thank you very much. I'll still continue. I'm monitoring the other cases, and we need to liaise with other teams to ensure that our doctors get the appropriate management. Thank you very much.
Okay. Thank you very much, Doctor, for your introductory remarks and for also giving us a clear picture of what is happening and for showing us what is going on with the people you lead. You know, many times there is a lot of focus on the patients, and there is little focus on the healthcare givers, you know, who are at the front line and are usually more exposed. So I'll now take it on to our panelists to dissect this issue. Dr. Oledo has given us an introductory bit, and now I want us to dive in and have a discussion about this. I'd like to begin with Goodluck, you know, Msinguzi, who is a journalist and observes many of these things. Goodluck, I would like you to paint for the people tuned in and you know, maybe those ones who are out of the country and or in other parts of the country where there is no, you know, much news about this situation. Help us, give us the status on ground. What is on ground?
Thank you very much. One, I must say, I've listened to the doctor and I've heard him. This is the second time making a passionate appeal on behalf of the doctors. I agree with him, and I freely say that we need to give them all the support. Now, what is on the ground? I want to also ask the doctor and others who are listening to us. I think in this country, we need to work on what we call behavioral change. Behavioral change, I was talking to someone, I was saying, do we also bring democracy in issues of doctors and nurses? If you have listened to the chairman of the association, he's saying it is now or never. It's a matter of life and death. Now, what is on the ground is that there are no resources. And what brings the problem with the resources is that it's the way we have democratized even health. So everyone is allowed to make a comment about health. So everybody is like, they want now money for stealing. If you say we need money for, if they ask money for vaccinations, no, they store money, they are stealing money. But if you can hear the passionate appeal from the doctor, and I listened to him even before, dressing up a person who is going to touch this sick person, we need 850,000 shillings. The medicine to give, if you are really in a bad condition, the medicine for 5 days, an antiretroviral, he can talk about those details. I hope you will forgive me about those names and whatever. We need 1.2 million a week. Now, that means before we add on these other things, we need 2 million per person. So in terms of our parliament, when they are appropriating money, I think for me, this issue, whether the money is misused or not, or whether the money is stolen or not, and I don't want to take that line of the debate, but for me, the debate I want to ask, why don't we provide enough money for Ministry of Health? Otherwise, the president said now they are going to have two mobile laboratories set up in the region, that is central Uganda. That's the region where we have Mubende and the other neighboring districts. We need ambulances, but then also people need money. So for me, I'm on, for the first time, I'm on this side where I'm asking, where is the money? And the money must, because unfortunately, our parliament is closing today. It is closing today. It is going in recess without providing for emergency money. So I am on the side of the doctors. I'm on the side of those who think our political leaders, today they are voting for other leaders to go in Iyala. But remember, our economy is being battered. The first day they announced Ebola, the message went across the world, tourists canceled, and I had the president last evening making a passionate appeal that tourists should come. Like the doctor says, this Ebola does not spread like other diseases. So if you are to save the economy, I think for me, yesterday, before Parliament finishes the voting and goes to recess, and for me, I can only say the Speaker and the Deputy Speaker, I don't know wherever they are seated, because they are mandated by law. It is not now the executive. Maybe unless if the executive is not putting a request. But if the executive, and from what the doctor says, and when I talked about mindset change, I was even talking to every one of us who wake up, we wake up and criticize. But when we criticize people, we need to first understand that this is a matter of science. Now, me who has done humanities, or I'm not a scientist, I'm quickly to criticize. They want more money. Now, when I go to even those who appropriate money, they are going to go on TV. We are going to host them on Civic Space TV. And the only thing we are going to hear from them is that Ministry of Health do this. But have you given them the tools? And the tools are not words. The tools is money. So I agree. If we hear that 6 professionals are sick or more than that, if you hear that we lost 64 people during COVID, people who are not replaceable. They are not replaceable. You need another 5-7 years to replace one of them. So for me, what is on the ground, I can tell you, is that there is no enough resources. We are coming from COVID where everybody criticized, where everybody, like, here we like criticizing. And I can feel that the health workers, those who are in the sector, leading the sector, they feel they have been battered enough. They have been battered enough. Everybody has an opinion. Everybody wants to put democracy in this. So we had a month. We lost a month. We should have detected this. For me, if the VHTs had not done their work, how about the security forces, the intelligence system? How can we lose one person? Okay, that one I can forgive you. The second person, the same condition. The third person, fourth, fifth, no. I think for me, but that one, for me, I want to take you backwards and say, as we punch holes into some of the things, I think there are sectors we need to agree that they need money and this money should be available. Yes, we can ask for accountability, but remember when we get in conditions like this, we are not going to get money tomorrow. So I listen to the doctor when he says, when he's making a passionate appeal to the speaker. I want to add my voice and say, Deputy Speaker Thomas Taiba, I saw you saying Parliament is going to recess. And I never heard you ask the executive to present a quick budget. So you are going to recess, but the disease is not going to recess. Our economy is not going to recess. Thank you very much.
Thank you, Goodluck, for that. But to be fair to government, Ministry of Health, I think had the biggest share of the budget. They had a big share of the current budget. You know, they are 7% of the GDP of that year. Year 2022, for example. So they had a big share. But of course, I also you make a strong point. I mean, still, even 7% is still below the 15% that is mandated. That is mandated by the WHO, and that is part of what we've signed for before in conventions. We've made commitments in the Abuja Declaration to make the health budget 15% of the national budget, but now it is 7% of national budget. We understand the other priorities. However, I must say, Ministry of Health has the biggest percentage. However, we can do more to comply with the Abuja Declaration of 15%. I want to come to you, Dr. Mark. I want you to come in. And continue to give us your view of how we should better handle this as a country. And as a background to that, Uganda is not new to viral outbreaks or epidemics such as Ebola, Marburg. We've just had a terrible pandemic, the COVID that cut across the entire world. But we should have learned better as a country to prepare, to be on the alert. You know, one would say one of the reasons we didn't have a lot of people die, a lot of fatalities in COVID, is because of Uganda's experience in handling epidemics, you know, and all those other, you know, kind of outbreaks. But then when we see Ebola coming again, and it brings into question, how prepared are we? How much have we learned from the previous experiences? So I want to invite our next panelists to have a say on that. Okay. Yes. Goodluck. So what can we? I'm wondering what we can do as a country besides.
Thank you very much.
You know, you're saying government. You know, government. What can we do as a country to be more prepared? Honestly, because it seems we are not learning from the previous experiences, which we've had a number of them, by the way.
I agree with you. But for example, you talked of the 7%. And of course, what came in my mind was the 15%, which talked about we need to make resources available. But why are we not doing things? And that's why I said, I go back to the behavioral change of every one of us. What are the politicians talking about? Because they appropriate money, but they are also the ones who speak to the people. So every other time you hear a politician saying, when we give that sector money, the money is, we shouldn't, there is no big problem. Run a nation in a mode where we say, we will act when a situation happens. So meaning we don't provide resources to improve situations and to keep also prepared. So for me, my thinking is that we have the best health workers. Our system is the best in the region. But then we need to provide the money. Because if you talk to the Minister of Health now, does he have the money? The senior management, when they sit, and because the good thing is that they are all doctors. They know what it means. They know what when we lost Dr. Rukia, when Ebola hit northern Uganda, I think for me that was an example or something to teach us as a nation that we should always protect our people, that our doctors, our nurses are on the front line every day. Every day. We thank God a day that goes without a viral disease attacking us. But then the people, the politicians who have the money, they say, let's wait for when it comes. So for example, we have the medicines, the COVID-19 vaccination. Everybody has lowered their guard. Everybody is behaving as if everything is right. And I still remember, I want to remind, for me, I would want to speak to the opposition members of parliament. I remember when we were hit by Delta across the country, when death was death, people were dying. And I remember a few faces I remember on TV who speak most. I don't want to say who shout most. They were saying, we want the vaccines now, like yesterday. When the vaccines came, they never spoke again. They never mobilized our people to go and take the vaccines again. So today, now what followed was issues that I don't want to dwell in the politics part of it, because for me, as a journalist, when you meet people on the ground now, when you go to Mubende, when you go to Kakumiro and Chegegwa, people, they don't want to listen to your politics. They want to see ambulances, they want to see medicines, they want to see us doing what is right. But what is right to be done, the Ministry of Health must be given money.
Okay.
And I can tell you why. For the first time, I'm making this passionate appeal because the chairman of Uganda Medical Association said, if their people are not looked after, if there are no materials to use, he said they should get away from the hospitals. And
Okay.
you know what that means?
Yeah, that's a
because me and you who is speaking,
yeah,
we
that's
are not
that would be a disaster for our health. Yes, I want to cut you short. Good luck. Because you introduced something that is very important, which I want Dr. Mark Kunihira to address now. You said Ugandans have lowered their guard, and it seems that people do not seem to mind at all. Now, Doctor, I want you to give us quick and practical measures we can take as people to prevent this and to prevent the catching the virus, and also to what can we do as first response in case we notice the person showing signs that Dr. Samuel Oledo referred to. What can we do? So those two tips for prevention, and then what can we do for response, first response?
Okay, thank you. Can people hear me very well?
Yes, we can hear you.
Thank you. I'm Dr. Kunihira Mark. I've been introduced before. Currently, I'm working in Soroti within a referral hospital. And I represent a group that is the Federation of Uganda Medical Assistants, which we aggregate as FUMI. Thank you for what you have asked. So, you're asking, we need a practical guide to see how we can get this prevention measures. We have learned a lot from the past COVID that was in not COVID, Ebola. And then we have also learned quite a lot from the previous COVID incidents that we had, the pandemic. I would really say viral infections are quite hard to handle. They spread very fast, and with the current situation that we are very mobile. Today I can be in Soroti, or I can be in Mubende. Sometimes it becomes a little bit hard for us not to mingle with people who have this virus. So I would say, one, really, the things are very simple. Let us follow the guidelines that the Ministry of Health has put in place. And one of the things is hand washing, because as we know, Ebola spreads through body fluids. It can be sweat, it can be blood, mere contact with the person. And the best that we can use here is jig. So at every point, really, in our homes, in our places of work, everywhere, we need to have stations of hand washing. Two, it's very important to keep watching out for our friends, watching out for our neighbors. If they show these symptoms, one of the things that were put in place recently, we had COVID task forces. Now, today, we have Ebola task forces. Their hotlines are out there. Be at any time willing to call out someone and come and see that patient. Let us not take a simple fever as malaria. Let us not take chills, feeling generalized body weakness or something small. Because the signs and symptoms of bleeding from orifices, that is the late manifestation of these things. Then I'd also like to say, maybe from our government point of view, that we need to move out. I'm looking at the interns at these different sites. It's clear that the first line of protection in hospital, what I would call in army, would be the corporals, are the interns. Really, and they're the people that handle these people. That's why you can see there's been an uproar from Movende, where we are having people, the interns coming up to riot. One, so we need to facilitate and have interns trained how to handle these emergencies. You know, every emergency comes with its own complications. Two, but lastly, but not least, I would say it's very important, as Dr. Oledo put, personal protective gear. Health comes first. If your health professional dies, probably you lose touch with about 50 or 60 people that will not be seen that day. I would say lead with government still to really facilitate the interns at these sites. One, two, have them have personal protective equipment, and really, it's not a challenge that we can fail to mitigate. Thank you very much.
Thank you, Dr. Mark Kunihira, for that. Would you want to add something on how to respond first when you see someone who is presenting such signs?
The biggest worry we usually have is stigmatism. And as a health profession, that is one thing that I really worry about. So
please unmute and go on.
Yeah. Can you hear me?
Yes, yes.
Yes, I was saying the biggest thing that we fear as health professionals is stigmatism. One, the response is quite simple. I would say if you find a patient that you suspect, find a person, be it in your home, that you suspect to be having Ebola, one is minimize contact with these people. That is the first thing. Every hospital, especially regional referral hospitals, they created an emergency ambulance service during the COVID period that can be used to evacuate patients from wherever they are. I know in our different locations, every regional referral has an ambulance system that is dedicated to that. So one, we minimize contact with that patient, with that person. Two, because at home there is little that you're going to do for that patient, call the district task force, call your local health center, call the ambulance service in your locality. Is the way out. Otherwise, if we start picking patients, put them in our corona vehicles, take them between transportation to the hospital, there is going to be a lot of contacts. And the problem in epidemiology comes with contact tracing. If we cannot have all the contacts traced up to that patient, that's where all the challenges will start from. If I carry a patient from Movende in my vehicle and transport them up to Mulago, I'm going to have quite a number of contacts compared to if I have this patient at home. You did minimize contact with them and have them being picked by an ambulance service for people that are trained to pick these people better. That is my submission of this.
Okay, thank you very much, Dr. Mark Kunihira, for that, for those tips and for helping us understand the preventive measures and how to respond. Thank you. Now, as we wrap up this discussion, Goodluck. You've listened to the discussion. You've heard what the frontline people are doing. You've also had to weigh in on the part of what government can do. Now, how do you think this should be reported in, for example, media? Because Uganda, let's face it, Uganda has had many challenges with pandemics, epidemics, endemics, and oftentimes media is always washed with these gruesome descriptions, So when a person who is outside Uganda, you say that the president was encouraging tourists and all that, but let's face it, Uganda is in international news now, and everyone is saying Uganda, or there is Ebola in Uganda, there is Ebola in Uganda, there is Ebola. And some countries are already considering blacklisting Uganda for now, or red listing, actually putting Ugandans on the red list and some blacklisting them and banning travels from Uganda. And unlike COVID, there are some diseases that are attached to names of a country. So when they say Ebola, people will say Congo, will say Sierra Leone and Uganda. So how can media respond, or how is media prepared to respond to news around this this pandemic and this epidemic, and how will media contribute or play a role in during this crisis? Which role will media play, if any?
Thank you very much. I think as media, one, we need to pick our information from one central place, either the Ministry of Health, but I have seen something that is a bit worrying. Every journalist and even those who are on social media, the citizen journalism. For example, the Kasangat issue, that the person has died. Painfully, the message when the person never died of Ebola. Now, what does that mean? You who is reporting, where did you get the information from? Why does our media let street talk be part of reporting science? For me, I think it is unfortunate, and most of our colleagues, the standard newsrooms know that you can't just write something without verification. So my appeal to everyone, even to those who have their phones, I know you have a right to write what you want, but please stop just writing anything you see and you say Ebola in Uganda without facts. Listen to the Ministry of Health, because that's where we will be able as a country to help, because you see, unfiltered information, and I don't want to say we should have filtered information and at the end of the day, try to control people. But the point is that if we are reckless with what we write without getting facts, we are going to hurt this country. And when we hurt this country, when it is red listed, I can tell you, all of us, whether in media, when the business is low, you will not get adverts. When URA is not collecting the taxes, you will not find the medicine. So for some reasons, it's only in this country, or I don't want to say Africa, but I want to say in this country, it is where we have democratized. In my first submission, I said, are we going to democratize doctors and nurses? Are we going to democratize health? So that each and every Tom and Dick will claim, will announce a disease, we will talk about how they are stealing money. So for me, I think as media, as citizens, we have a role and duty to pick only that message which is confirmed. And that's why you see, even last night, one of our media outlets, the president was a little bit of angry, because even when they also tried to say there is confusion, they also added more confusion, because what the Ministry of Health was reporting is not what they are reporting. So yeah. I'm requesting each one of us that we saw when the world shut down, the economies are going to take generations to pick up. Yeah. But now when we have our country singled out, we are going to suffer alone. And of course, the suffering is already there. Ukrainian war and all these other problems that are not going tomorrow. So for me, I would request also the politicians, the church leaders, the cultural leaders. I would wish one of the people I listen to every other time he speaks in this part of the world, I would wish to listen to the Prime Minister of Uganda. Mm-hmm. Charles Maiga on behalf of the Kabaka. We know the Kabaka also is the ambassador of UNAIDS. Can they come out and they speak? And because I told you, there is one problem I'm seeing as a journalist, behavioral change. Behavioral change. This morning I met friends and colleagues and they are still greeting. And when I refuse to give a handshake, somebody saying, no, this business, everybody has an opinion. But for me, I told them on science, on disease, I don't have an opinion. So let's follow one center of picking information so that we don't hurt ourselves, we don't hurt our country. Thank you very much.
Okay, thank you. Thank you for that. Yeah, and it's important that media also verifies, like you've said, and more in international media, it does injustice to a country, it does injustice to a people when facts are not reported well. Because when media is reporting that there's an outbreak of Ebola, they say there is an outbreak of Ebola in Uganda. Let's face it, Uganda is a big country and very diverse. To say Ebola outbreak in Uganda, well, is to present only one aspect or a small aspect of the picture and broadening it. And that hurts not only the people, it hurts the economy, and it generally affects the way things happen and the outlook. What usually is better, and you see this in many countries in Europe, in North America, when they're reporting, they do not say a typhoon has invaded all their floods in America. No, they say there are floods in Puerto Rico, there are floods in a part of Puerto Rico. They say there are an outbreak in this, when COVID was quite high, we used to hear a lot about New York, parts of New York. We didn't hear so much the entire country. So international media should also do its role in being specific and not compounding things, because Africa is diverse. Countries in Africa are diverse, and more so, each country in Africa is diverse and big in its own way. It would be an injustice to say there is an Ebola outbreak in Uganda. Uganda is big, and more so, we should always present a positive story of how much is being done to curtail this, to ensure that this does not go out of hand. Otherwise, other places like Kampala, I don't know whether Kampala has registered a case yet, but many populous places haven't registered a case yet. That doesn't mean we negate the preventive measures. We actually supposed to do more, but that again shouldn't make things stand still. Guidelines are there. Everything is there for people to follow. Let them be followed, and let the journalists also present the real story. I want to give you 1 minute, Goodluck, to give your parting shot and encourage people to be positive in this. This will be overcome. Yeah. Over to you, Goodluck.
Yes. Hello. Thank you very much. Yes. Thank you very much. And as you said, in my parting shots, I would like to say that those media who the international media is represented here, and most of the guys who feed the international media are from Uganda, and they are Ugandans. But we suffer one disease in media. In the bid to want to be the first to report, sometimes we have hurt this country. Nobody wants to wait a little bit. Nobody wants to, if you have seen the crashes, we have had the accidents. Sometimes you saw a video from police with the cameras. Sometimes I always say, if you waited 30 seconds or 1 minute, maybe you could avert that accident. Now, even in terms of reporting, if some of us can say, let this story be published tomorrow, Let's re-verify again. So, but for me, the unfortunate part is that those who are reporting those things in the international media are here, and for them, what is on their mind is being the first to report. But in the process, as you said, they are reporting, the reportage is Uganda Ebola. And when you go on Google, definitely all of us, as we speak today, we should be sick. And as you have said, Kampala, I don't know why the media feels as if they want a case in Kampala. You see how people put in vigor looking for this. Hey, we have heard this here, rumor mongering, pushing the rumors. And for me, that's why I said, as I end, let's separate politics from health. Let's not democratize health. Otherwise, if we let every Tom and Dick do this, then it will be very unfortunate for us, because these days, as we look at some of these issues, as you said, we need to look at our economy, our country. It all hurts us. It comes back. The second quarter, October, November, December, people thought maybe something was going to improve. And I can tell you, I don't see anything improving. And the economy is going to batter us again more. So for me, even when we are declared free of COVID, of Ebola, it will take another few months for the world really to accept that we are free and for them to come and do business with us. So it's very unfortunate. I ask my media friends, I also ask the members of parliament, and I ask everybody, every politician who has made it a habit of speaking most. And when there is a cause, you hide, don't hide. When there is a cause, come up and speak. We also ask the cultural leaders, the religious leaders. Tomorrow, the other day, we are going to be in church on Sunday. Tomorrow, we are going to be in mosques. Yesterday, I followed a church service somewhere in Kabale. None of the leaders, not even the religious, none spoke about Ebola. They only spoke about things that can give them votes. How about when the disease comes and it batters your people? So for me, I am a bit of angry. I feel that our leaders and whoever is supposed to really help in this, they are quiet. They think Minister of Health, these people, as you heard the doctor, they are going to be in their homes. If they don't work on us, it will be bad. Thank you very much.
Thank you very much. Good luck for that, and also for being part of this show. Before we end, I would like to reiterate what our doctors said, what specialists and experts are saying. Please regularly wash your hands with soap and water. Keep toilets or latrines and door handles clean. Please keep the latrines clean, keep the toilets clean at all time after use. And when you're doing that cleaning, please use gloves as much as possible. Use a lot of soap and always use disinfectant soap. Please regularly wash utensils and clothes and your clothes. And very importantly, keep safe distances, because we've heard that it also comes from contact. Still, COVID is still there. Let us not think that Ebola has replaced COVID in a sense. These are diseases that are, all continuing, at the same time, and it's worrisome, but we can still beat it. We may not also so much throw blames here and there, because as we know that diseases mutate, they transform into all these viruses and infections of bacteria always mutate. They change tribe, and there are very many tribes. So, and this is what the Center for Disease Control is saying, that they're also wondering why this particular tribe that is prevalent now, the Sudan virus, is where it keeps hiding, and they continuously studying to find out the different nature or different behaviors of these viruses. And we applaud all our scientists for the work they're doing. We believe in you. We know that you are going to help us overcome this. We know that your contribution is not fit. It's something we value, and we know you helped us in COVID. You'll help us overcome Ebola. Likewise, you help us each and every day to manage and even treat diseases that affect people on a large scale, like malaria, name it. So we believe in you. We also believe that our systems will this time deliver the much needed assistance that the first responders require. As Center for Constitutional Governance and Civic Space TV that hosts this community show, we continue to encourage all of you to keep safe. When a case is reported or you see someone with signs, calmly handle the situation, call the nearest medical facilities at divisional level, at district level, and they will help the situation. Where a person has those signs and symptoms, be hesitant a bit to get in contact, but urgently call for help. So with that, I thank all of you for being a part of this community show, and we thank our hosts, the Center for Constitutional Governance and Civic Space TV, and I moderated. We also thank our contributors to this conversation for their insight and very knowledgeable tips. We thank you, and I sign out. Have a lovely week.